That constant ringing, the buzzing, the hiss? It's called tinnitus, a sound only I can hear. Tinnitus is the perception of sound, such as ringing, buzzing, hissing, or roaring, in the absence of an external source, and it can affect one or both ears. Bilateral tinnitus, which is sound in both ears, can stem from a variety of causes, while unilateral tinnitus is the perception of sound in one ear and can be a sign of underlying pathology that requires thorough evaluation. Next, we will look at some causes of tinnitus. Tinnitus from age-related presbycusis is usually bilateral, gradual in onset, and associated with high-frequency sensor and neural hearing loss, best evaluated through a full audiogram to determine the extent and pattern of hearing impairment. Many people experience tinnitus after being exposed to loud noise in a workplace setting or at a sporting event or concert. Tinnitus is also the most common service-related disability among veterans because of loud noise they may have experienced from gunfire, machinery, bomb blasts, or other similar sources. Tinnitus can be a side effect of taking certain medications, especially if they are taken at high doses. Ototoxic medications include aspirin and aminoglycosides. Impacted earwax is a common and easily treatable cause of tinnitus and should be evaluated through a simple ear examination by a healthcare provider. Head or neck injuries can lead to tinnitus by damaging the ear structures, the auditory nerve, or the parts of the brain responsible for processing sound. When associated with progressive hearing loss, imbalance, or facial numbness, vestibular schwannoma, which is a type of brain tumor arising from the hearing nerve, should be considered, and MRI with internal auditory canal protocol is recommended. A glomus tumor, a non-cancer growth that can form inside the ear, often near blood vessels, may cause pulsatile tinnitus and is often visible on otoscopic exam as a reddish mass behind the tympanic membrane. Otitis media with effusion, which is an inflammation or infection with fluid buildup in the middle ear, often causes muffled hearing and a feeling of fullness, and is diagnosed using pneumatic otoscopy or tympanometry. Otosclerosis, a condition in which abnormal bone growth in the middle ear can be suspected when tinnitus coexists with conductive hearing loss in a young or middle-aged adult, especially with a positive family history. Temporomandibular joint dysfunction often causes unilateral tinnitus that worsens with jaw movement or clenching and may improve with dental or physical therapy. If tinnitus follows barotrauma, such as diving or flying, consider inner ear injury or perilymphatic fistula. Vascular causes, such as high blood pressure, atherosclerosis, carotid artery stenosis, or arteriovenous malformation, especially if they are in or close to the ears, should be evaluated if tinnitus is pulsatile and synchronous with the heartbeat. Meniere's disease often presents with unilateral tinnitus initially, along with vertigo, ear fullness, and fluctuating hearing loss, and is best evaluated using audiometry and vestibular testing. Chronic conditions such as diabetes, migraines, thyroid problems, anemia, and autoimmune diseases like lupus and multiple sclerosis have all been associated with tinnitus. Tinnitus, whether unilateral or bilateral, can be frustrating, even debilitating. Get it checked. Evaluation of tinnitus includes a detailed history, physical examination, and audiometric testing to assess hearing loss, with further imaging like MRI, CT scan, or ultrasound can help reveal whether a structural problem or underlying medical condition is causing your tinnitus. Next, you may be referred to an otolaryngologist, commonly called an ear, nose, and throat doctor, or an ENT. Don't ignore the sounds your body makes. Talk to your doctor. Find answers.